Welcome all to the mock test explanation series for Government Nursing Officer exams. Let us go to the question answer session now. The first question, the following are the contraindications of induction of labor except option A, premature rupture of membrane, option B, placenta previa, option C, cephalopelvic disproportion, option D, cord prolapse. Let us go to the right answer. The right answer here is premature rupture of membrane, option A. Let us see the contraindications of induction of labor. There are absolute and relative contraindications. The absolute contraindications include severe placenta previa and transverse or oblique fetal lie. Relative contraindications are active genital herpes and high and floating fetal head. Some other contraindications include cord presentation or prolapse, cephalopelvic disproportion, previous cesarean section, breech presentation, and cervical carcinoma. Next question. The gland which produces melatonin is option A, pineal gland, option B, thymus gland, option C, pituitary gland, option D, adrenal gland. The right answer here is option A, pineal gland. Pineal gland is located at the roof of third ventricle. It is the smallest gland in human body. You can see the location here. It is at the roof of third ventricle. It is the biological clock which controls the circadian rhythm. It produces the hormone melatonin. So the important points are, it is the smallest gland in the body. It is the biological clock which controls circadian rhythm and produce melatonin. Next question. A nurse has just performed an NG tube insertion procedure. Most accurate method for confirming the NG tube placement is option A, X-ray, option B, auscultation, option C, observing patient for coughing, aspiration of content and pH monitoring, option D, dip in a bubble of water. The right answer here is option A, X-ray. Here the key word is most accurate because most of these options are right, but one is most accurate, that is X-ray. Most accurate NG tube confirmation method is X-ray. Auscultation and gastric content aspiration and pH monitoring is also options, but most accurate is always imaging and X-ray. Next question. A standardized test for gross and fine motor skill for children is option A, Glasgow Coma Scale, option B, Pain Assessment Scale, option C, Denver Development Screening Test, option D, BOT or Brunin's-Ostrowski's test. The right answer here is BOT test. BOT test is the test for motor skill in children. Glasgow Coma Scale is for the level of consciousness in neuro conditions like head injury, unconscious patients, etc. Denver scale, it is the developmental scale. It will address the development issues in children up to age of 6. Next question. All the below are synthesized from amino acids except option A, insulin, option B, steroids, option C, hemoglobin, option D, antibodies. Here also you have to see the keyword except because only one is not synthesized from amino acid, all other are synthesized from amino acid in these options. Let us see the right answer. The right answer here is steroids. Steroids are made up of lipids. So steroids are the only one in these options made up of lipids, and the other options like insulin, enzymes, hemoglobin, antibodies all are synthesized from amino acids. Next question. Which one of the following anti-tuberculosis drugs cannot be given during pregnancy? This is also again negative word, cannot. So one cannot be given and all other three can be given. The right answer here is option C, streptomycin cannot be given during pregnancy. Anti-TB drugs contraindicated in pregnancy are streptomycin, kanamycin, amikacin, capreomycin, fluoroquinolones, and prothionamide. The anti-TB drugs which are not contraindicated or comparatively safe in pregnancy are isoniazid, rifampicin, and ethambutol. Pyrazinamide is also can be given, so this is also an option, but these three, isoniazid, rifampicin, and ethambutol, are more safer in pregnancy. These top drugs like streptomycin, kanamycin, amikacin, etc. are not advisable in pregnancy, which all are contraindicated in pregnancy. Next question. Which ophthalmic diagnostic test measures the intraocular pressure? Option A, tonometry. Option B, perimetry. Option C, gonioscopy. Option D, Amsler grid test. So the right answer here is option A, tonometry. Tonometry is the test for measuring intraocular pressure. You can see the diagrams here in this side. Perimetry will check the peripheral vision. You can see here. Gonioscopy is the test for drainage angle of the eye, and Amsler grid test is to detect the macular degeneration. Next question. A patient on assessment has found to have hypokalemia. Nurse is assigned to administer the which of the following intervention is not done. So the interventions given in which one option is not appropriate. So which one is to be not done? Option A, intake output chart monitoring. Option B, potassium IV solutions should be administered only in well hydrated patients. Option C, fast intravenous infusion. Option D, potassium infusion administration should be through a large high flow way. The right answer here is fast intravenous infusion. That is not advisable, not done. The reason you can see here, the potassium administration, intake output chart monitoring is necessary. Potassium solution should be administered in hydrated patients. These all are appropriate. But here the negative word not, which is not appropriate, is fast intravenous infusion. Because fast intravenous infusion can cause arrhythmia and cardiac arrest also. So that is not advisable. Potassium infusion should be administered through a large high flow vein. That is correct, because if it is a very small or obstructed vein, lot of pain will be there for the patient, because KCL is a painful infusion. So the fast intravenous infusion is not advisable. That is the right option in this question. Next question. The following are the principles of health education except option A, unknown to known. Option B, comprehension. Option C, credibility. Option D, interest. The right answer here is option A, unknown to known. Let us see the principles of health education. That is known to unknown, motivation, interest, participation, feedback, reinforcement, credibility, comprehension, collaboration. So first is known to unknown. Now I will explain you some memoretic. First you need a motivation, then you have to get interest, then participation, you have to participate, then you will get feedback, then you have to reinforce. So motivation, interest, participation, feedback, reinforcement. Then 3 C's, credibility, comprehension, collaboration. These all are the principles. Here you see the options. The question it is showing except, so one is wrong and the other 3 are correct. Here you can see it is the known to unknown is the principle. Here it is just opposite. You will be mistaken, but it is just opposite. Unknown to known, that is not correct option. So that is the right answer, because the except negative word is given here. Comprehension, you can see it is a part of health education principle. Credibility is also added here. Interest is also here. Next question. Patient is undergoing blood transfusion and suddenly patient shows complaints of transfusion reaction. What will be the priority nursing intervention? Option A, stop the infusion and remove cannula. Option B, stop the infusion. Option C, complete the transfusion and administer injection away. Option D, complete the transfusion and discard the bag. The right option here is stop the infusion. We can see the application level question, how we are handling it. This is the example. Here priorities and guidelines are not much evident because ABC and all it is not here. Here application of your knowledge and logic and practical awareness is counted. Here you can see when a patient is having allergic reaction with the drug or with the blood, you have to temporarily pause that. That is the first thing. So complete the transfusion and administer injection away. Complete the transfusion and discard the bag is not advisable at all. So these two options can be eliminated. So this is the elimination. So remaining is two options. From this you have to choose the most appropriate. Here you will analyze this option. Stop the infusion and remove the cannula. Stop the infusion. If you remove the cannula, if you need to give some anti-allergic medication or hydrocortisone or any other emergency medicine, you cannot do it. So removing the cannula is not advisable. So stop the infusion only. This is the way you have to handle this kind of questions carefully and select the right answer. Next question. Which of the following is an example of hinge joint? Option A, wrist joint. Option B, radio-ulnar joint. Option C, shoulder joint. Option D, elbow joint. So one of this is hinge joint. What is that? The right answer is elbow joint. Let us see the types of joint according to these options, because the other detailed portions of joints and muscles will be discussed in skeletal-muscular anatomy session. Wrist joint is condyloid synovial joint. Radio-ulnar joint is synovial pivot joint. Shoulder joint is a ball and socket joint. And elbow joint is synovial hinge joint. So the hinge joint here is elbow joint, which is the right answer. Next question. The largest lymph organ is option A, spleen. Option B, thymus gland. Option C, liver. Option D, pancreas. The right answer is option A, spleen. Let us see the lymphatic system. The spleen is the largest lymphatic organ in the human body. See the location in the diagram. It is just above the stomach. So this is the spleen, which is the largest lymphatic organ in human body. Next question. In burn patients, isotonic fluid is given to prevent the risk of option A, renal failure. Option B, inadequate lung perfusion. Option C, hypovolemia. Option D, electrolyte imbalance. The right answer here is option C, hypovolemia. Isotonic solutions like RLNS are given to increase the fluid volume. So that is the hypovolemia correction. That is the right answer. Renal failure will not be solved by giving solutions. Inadequate lung perfusion cannot be solved by fluids. Electrolyte imbalance can be only solved using replacing with electrolyte solutions like sodium or potassium, etc. Next question. The following are the characteristics of fetal umbilical cord except option A, umbilical cord has sensory nerve endings. Option B, umbilical cord contains two arteries and one vein. Option C, umbilical cord is enclosed and protected by Wharton's jelly. Option D, umbilical cord transport oxygen and nutrients to the developing fetus. So here also the word except is there. So one is right and one is the wrong option and all other are right. Here the right answer is option A. Umbilical cord has sensory nerve ending. This is the wrong option in this. So let us see the peculiarities of umbilical cord. Umbilical cord is usually about 50 to 60 centimeter long and 1 centimeter in diameter. It is a soft pale yellow and has spiral or coil along its length. It will coil. Blood vessels are two arteries and one vein. You can see these two arteries, one vein. Wharton's jelly. Umbilical cord is surrounded by Wharton's jelly. Amnion. The umbilical cord has a smooth outer covering of amnion. Blood flow is from the fetus to the placenta through arteries and back to the fetus through the vein. So, see here, umbilical cord has sensory nerve ending is the only wrong answer here. Umbilical cord contains 2 arteries and 1 vein, that is right. Umbilical cord is enclosed and protected by water jelly is right. Umbilical cord transport oxygen and nutrients to the developing fetus is also right. That is the function of umbilical cord. So, that is the right answer. Next question. Which one of the following is the third cranial nerve? Option A, oculomotor nerve. Option B, optic nerve. Option C, abducens nerve. Option D, trochlear nerve. The right answer here is option A, oculomotor nerve. Let us see this chart for memorizing. The green color is for sensory nerves and the blue is for motor nerves and the mixed color is for mixed nerves. So you have to remember all these 12 nerves using this color code, using this chart, and by your own memory methods, memory tricks. I will show you one memory trick. For example, there are 3 sensory nerves, 5 motor nerve and 4 mixed nerves. So with the color in the chart and numbers, you have to remember in this order. 3S, 5M, 4 mix. 3S is nerve 1, 2 and 8. Motor nerves are 5M, 3, nerve 3, 4, 6, 11, 12. 4 mixed nerves are 5, 7, 9, 10. Next question. Which of the following conditions is not involved in Croup syndrome? Option A, tonsillitis. Option B, tracheitis. Option C, bronchitis. Option D, laryngitis. The right answer here is option A, tonsillitis. Croup is also known as laryngotracheobronchitis. So the word not is involved. So laryngitis will be there, tracheitis is there, then bronchitis is also there. So tracheitis, bronchitis, then laryngitis. So 3 inflammations are there: tracheitis, bronchitis and laryngitis, but tonsillitis is not added there. So the word not is very important. So this is not added. Next question. Which of the following food should be avoided when the patient is on MAOI, monoamines oxidase inhibitor kind of drugs? So option A, calcium rich food. Option B, thiramine containing food. Option C, gluten rich food. And option D, alanine containing food. The right answer here is option B, thiramine containing food. MAOI category of drugs, thiramine restricted diet should be followed. Thiramine is an amino acid that regulates blood pressure. The interaction of thiramine with MAOI can cause dangerously high blood pressure. That's why with MAOI, we cannot take thiramine rich food. Thiramine restricted diet should be followed. Next question. The immunoglobulin, which represents approximately 75% of human antibodies, is option A, IgG, option B, IgM, option C, IgA, option D, IgE. The right answer here is option A, IgG. Let us see the chart of immunoglobulins. IgG is 70 to 75%. It can cross the placenta. That is a feature. IgA 15 to 20% found. It is present in breast milk. That is a feature. Immunoglobulin M is the first antibody released. It will be found 5 to 10%. And IgE is very less in amount. It is 0.5%. Next question. An outpatient department nurse is providing health education to a 40-year-old person regarding the lifestyle modification to prevent hypertension. What level of prevention is the nurse providing? Option A, secondary prevention. Option B, quaternary prevention. Option C, primary prevention. Option D, tertiary prevention. The right answer here is option C, primary prevention. Let us see the disease prevention methods here. First one is primordial, that prevents the development of risk factors itself. For example, promoting healthy lifestyles from childhood itself. Primary prevention is modify the existing risk factors. For example, vaccination. Vaccination will prevent. So these all are the primary prevention methods. Secondary prevention is early detection and treatment of the disease. For example, screening for a disease. Tertiary prevention is already the disease is happened, but we will stop the progression or improve the quality of life after the illness. For example, rehabilitation. Next question. Winding of scapula after mastectomy due to damage of which nerve? Option A, long thoracic nerve. Option B, brachial nerve. Option C, radial nerve. Option D, femoral nerve. The right answer is long thoracic nerve. This is the winged scapula. You can see the diagram here. In a mastectomy, the long thoracic nerve is the crucial anatomical structure that surgeons must carefully avoid damaging during surgery. Injury to this nerve can lead to a condition called winged scapula. Here you can see that, where the shoulder blade appear to protrude abnormally. This is protruding here, shoulder blade. That is winged scapula. So the long thoracic nerve should be handled carefully during surgery. Next question. Which of the following are indications for electroconvulsive therapy except major depression, severe psychosis, severe catatonia, post-traumatic stress disorder? The right answer here is post-traumatic stress disorder. Let us see the electroconvulsive therapy and indications. Severe depression. When other treatment cannot be, effectively implemented, then severe depression it can be. Bipolar disorders, when other treatment have not worked or in manic phase. Schizophrenia, when other treatment not worked and in catatonic symptoms. So catatonic schizophrenia. Acute illness to improve quickly to save their life. If he is in a life-threatening condition, so the disease should be improved by ECT. Next question. The drug prescription is 20 microgram. Available dose for a drug is 30 microgram per 15 ml. How much ml is administered? Option A, 10. Option B, 18 ml. Option C, 20 ml. Option D, 25 ml. This is a drug calculation. Take your own time by pausing this screen and find your answer. Let us go to the answer. The right answer is option A, 10. Let us see the calculation. Required dose is 20 microgram. 15 ml has 30 microgram. So 1 ml has 30 by 15 is equal to 2 microgram per ml is there. That is the dose. So always per ml dose you have to find or any calculation. So 1 ml is 2 microgram here. So to get 20 microgram, you have to find the ml by 20 divided by 20 is the total microgram required dose. So 20 divided by 2. 2 is the per ml dose. 20 divided by 2 is 10 ml is required for getting 20 micrograms in this vial. So the answer is 10 ml. Next question. Respiration which is abnormally shallow for 2 or 3 breaths followed by irregular periods of apnea is termed as option A, Kussmaul's respiration, option B, Biot's respiration, option C, hypoventilation, option D, chain stroke respiration. The right answer here is option D, chain stroke respiration. Chain stroke respiration is alternating periods of apnea and hyperventilation. It is seen in congestive heart failure. Kussmaul's respiration is a deep labored breathing pattern in a metabolic acidosis. You can see in metabolic acidosis, deep labored breathing pattern. Biot respiration is almost similar to chain stroke respiration. It is also with rapid breath and apnea, but here it is irregular periods. It's more irregular periods of rapid breath followed by pause. Here it is alternating periods of apnea and hyperventilation is seen. That is chain stroke and Biot's. It is irregular periods. So Biot's respiration is seen in meningitis. Okay. So this is chain stroke is in CHF. Kussmaul is in metabolic acidosis and Biot's respiration is seen in meningitis. Next question. An Anganwadi worker assesses the malnutrition status by assessing option A, learning skills, option B, height, option C, weight for age, option D, self-feeding skills. The right answer here is option C, weight for age. Assessment of malnutrition including weight for age, height for age, weight for height, mid-arm circumference, etc. So these all are most commonly used for assessment of malnutrition. Here in this option you can see height just given. Height for age is not mentioned. Learning skills have no relation with the malnutrition. Self-feeding skills also no direct relation with the malnutrition. So it can be affecting, but if another person is feeding, maybe the patient will be getting correct weight. So weight for age, the patient's weight will give you the clue along with this kind of height for age or sometimes weight for height sometimes and mid-arm circumference sometimes. Always weight for age is the most commonly used tool for malnutrition. Last question. Which variable is manipulated in experimental research? Option A, independent variable. Option B, dependent variable. Option C, outcome variable. And option D, criterion variable. The right answer here is option A, independent variable. See here, independent variable is manipulated variable. That is the manipulated variable. In experiment research, it is the manipulated variable. The types of variables are see here. Manipulated variable is independent. Then dependent variable is response variable, and controlled variables need to keep constant to properly measure the effect of manipulated variable on dependent variable. So always manipulated is independent. Independent manipulated. You have to remember like this, independent variable is manipulated variable. So thank you all for watching this video. We are winding up this session and I will come with more videos for exam preparation. Please like and